Hi, everyone. Welcome to the next show. We are going to talk about an issue which concerns me greatly. I have thought about a lot, and that is blood pressure. And whether having a gold standard blood pressure, 120/80, is right for everybody. It seems a bit strange that we would have the same blood pressure goal for everybody. And we're going to talk openly and transparently as two doctors about our thoughts and concerns with regards to this issue. And for anybody who enjoys our discussions, please make sure that you've signed up for our separate channel down below in the description. Subscribe to that, where we have a lot of these open, honest discussions about issues affecting your health and well-being. So, Peter, would you like to start as a cardiologist? What is blood pressure and what do the numbers mean?
Gladly, Sunil. Blood pressure is such a big topic, and many people out there are being treated for it and may actually not know what it actually is. So blood pressure is the pressure within the vascular system, the arteries invades around your body and how your body, the vessels expand and constrict. And it's really just to keep pressure and blood flow going throughout all your organs. And so what everyone is most familiar with are the different numbers for blood pressure. So you have the top number and the bottom number, and always is debating which one is the most important number. So the top number, which we call systole, is when your heart squeezes, right? It's when it's contracting. And so that's why it's a higher number, because it's a higher pressure system. And then when your heart relaxes, that's called diastole. And that's the bottom number. And that's the number that is obviously on the bottom, and it's lower because it's when your heart is relaxing and the pressure is going down.
That is a fantastic explanation. Thank you. Yeah, so that is it in a nutshell, as your heart is contracting and then relaxing. And there's a lot of debate over which number to look at most, what is most important. Generally, people will tend to look at the top number more and be concerned, but often the two correlate. If the top number is high, then so is the bottom number. It's very rare to get isolated diastolic high blood pressure. So you have systolic and diastolic, those two numbers that you look at. Let's really think here what's going on at a scientific, physiological level. And why we still have within the medical establishment this notion that everybody's blood pressure should be 120/80. Of course, always speak with your doctor, especially if you're on any medications. Make sure that you're being treated correctly. Maybe you have a reason for more aggressive blood pressure control. Everybody's unique. But what do you think, Peter, about my hypothesis that having this gold standard for everybody is a bit crazy?
I do agree with you, Sunil. It's the sort of the guideline rigidity where we're chasing numbers and not the actual person, because I can tell you that all my patients are different. And so what might be a good blood pressure for one patient actually can be very dangerous. I think we have this notion that low blood pressure is always healthy, but that's really not all the case. Actually, sometimes low blood pressure can be very harmful.
It can, yes, and we've spoken about that before. Overtreatment of blood pressure, I believe it's a national scandal. Especially as anybody gets older, blood pressure can often drop with time, particularly if anybody's improving their metabolic health and people are over-medicated. Their blood pressure systolic number will drop to the low 100s, like 102, 103. They'll start to feel dizzy and then be more prone to falling.
Mm-hmm.
What do you make of the discussion, which I subscribe to, that every year the medical authorities are getting more and more aggressive with this? And particularly in older people, I've seen evidence that you should not be aggressive with blood pressure. The great vessels around the heart have heavily calcified.
Sure.
And I'm not suggesting that you let people's top number go up to 200, but why is the medical establishment and medical societies, why are they so obsessed with lowering blood pressure?
That's a really good point, Sunil. And you're right. There's hardening of the arteries as people get older, and that's why we see high blood pressure is more prevalent as you get older. Occasionally, we do see it in younger patients, and that should be really key, that you should be looking for something else going to by that's driving up the blood pressure. But it is the whole act of keeping one patient at one number. And now, the whole notion of blood pressure control is we do know that it can reduce the risk of stroke, heart attack, many other vascular diseases, kidney disease. But it also comes to a point where, as I talked about before, your blood pressure is the flow of blood through your body. So if you imagine, if you're older, you have hardening of the arteries, your body can't equilibrate and you get very big swings in your blood pressure. And this is very common. What I see is that people come in, blood pressure is really high or blood pressure is really low at times.
Yep. And that's what you have to be very careful of. And when it drops, people tend to get dizzy and they're prone to falling, other complications.
Yeah. So, what I see a lot is people chasing after the really high numbers, not realizing that patient actually can bottom out at home. So we all know the notion, and lots of people probably know this or feel about white coat hypertension. And there's also masked hypertension where people actually have higher blood pressure at home. It's a very complex diagnosis to manage, but you really need to be talking to the patient and just telling them that your blood pressure needs to be at this level no matter what really just doesn't work, and actually a lot of times can be quite dangerous.
Yeah, that's true. And I once saw an article about how it was basically asking, well, what is the ideal blood pressure beyond a certain age? I think it was 85. And they found like a U-shaped curve almost where people did better with a systolic blood pressure, which was in the 150s or 160s. Again, this is one study, and I'm not saying that that's a goal because, again, everybody is different and should have this discussion with your doctor. But I really think that we are overly aggressive. And I've met many older people above 70 who, when their blood pressure even gets to the 110s, so systolic blood pressure 117, 118, they start to have symptoms because maybe their natural blood pressure is 130, or what it should be is 130 or 140 systolic.
Absolutely. In my practice, if you're above 85, I do believe that 150 over 90 is probably an acceptable range if you're not having any symptoms and you don't have any other significant high risk, other comorbidities or problems. But as you think about it, the lower your blood pressure is, the less perfusion to your brain. And that can affect a lot of different ways. Less perfusion to your brain can be dizziness, brain fog, memory issues. Your kidneys are getting less blood flow. We all lose kidney function over time. Every year we lose kidney cells. That's just a natural process of us all getting older. But under perfusing those organs can lead to what we call end organ damage and really symptomatic in people. I think the biggest thing that we worry about is just the falls that people have from this.
That's right. I believe it's a scandal of epic proportion. I mean, I've talked about it before and I've given lots of advice in my videos. Please keep close watch on your blood pressure at home, especially with each passing year. Go to your doctor, review the readings. But I have a very close family member, very dear family member, who earlier this year had just finished making breakfast and said that he was feeling dizzy, not well. Sat down and we measured his blood pressure and it was in the 70s systolic, 70, the top number. And he was starting to look pale, and fortunately we were able to lie him down, hydrated him, and it gradually increased. And then I looked at his blood pressure readings, and this is the classic scenario. Got put on blood pressure meds in his 40s or 50s. These escalated over the years, all these doctors piling on pills. And he's over-medicated. And looking back, he's been dizzy, giddy, not himself for some time. And I'm convinced that he's been over-medicated. Now, thankfully, we were able to stop one of his blood pressure medicines, drastically cut back on the other. And now he's feeling better. I think this is happening to millions of people. And it is because the medical establishment is so focused on numbers and medicating. How do we get over this? And how do we personalize care more? Because this is my hope for you, that if you're in this situation, that you have a doctor who is personalizing everything and thinking, what is the right blood pressure for you? How should we be careful of not overtreating you?
It's so true that blood pressure as a diagnosis is probably one of the diagnoses that people get overtreated and end up with polypharmacy on it. Of all the diagnoses I see, and you're right, people start off at a younger age, get put on medications that no one stops. As people get older, the volume of distribution, meaning how that medication dissolves in your body, gets more concentrated. Side effect profiles go up. People lose weight over time. Some people lose weight intentionally. Their blood pressure medications aren't always stopped. Do you really need that third blood pressure medication? Or can you maximize the one you're on? Is it the timing of the medication correct? Are you taking them all at once? Is it better to space them out? There are so many different ways, but really what always should be started first is how can I change this naturally?
Yep, absolutely. I'm so glad you touched upon that because, yes, the main cause statistically of high blood pressure, especially when somebody's younger, is insulin resistance. And many people work on naturally reversing that. I mean, at the opposite end of the spectrum, we don't want blood pressure to go too high because when somebody's very metabolically unhealthy, they're overweight, then we're talking about a risk of stroke. So I'm not saying that blood pressure medicines are not needed. Yes, and I frequently deal with this in the hospital. Sometimes people's blood pressure is like well over 200, 210 systolic, and we give them intravenous medications because they're at urgent risk of stroke and they have lots of risk factors and they might already be having symptoms of stroke. That's not uncommon either. But at the other end of the spectrum, we have people who are doing things right. We're started on blood pressure medicines, and they get older and their blood pressure drops. And their doctor is so focused on numbers because that's the way things currently work. Let me ask you this, Peter. So my advice to people on pills who suspect that this is a problem for them, I say document your blood pressure at home for a few weeks, ideally 2 weeks, morning, afternoon, and evening, write it all down, and then take your blood pressure machine to your doctor's office, cardiologist's office, and check it. What are your thoughts on how anybody can monitor their blood pressure at home? Okay, everyone, I'm going to interrupt that tremendous discussion for a moment to tell you about our expanding health and well-being store. I'm very proud of our natural, uniquely formulated products. Check in the links down below. We've got our natural anti-inflammation immune support, bone support, memory support, heart support, and sleep support. Also, our newly released organic chai mix based on the tea that I regularly drink. We are made in the USA and very proud to be working with a veteran-owned company. Ohighwellness.com if you're in the USA, North America. Ohighwellness.co if you're in the UK, Europe. All right, back to the discussion.
That's a really great topic, and a lot of people don't know how to do that. I always think a arm cuff is much better than a wrist cuff. Wrist cuffs seem to be sometimes more convenient. Sitting down, waiting about 5 minutes, having your arm at heart level, that can alter your blood pressure. Checking your blood pressure. I usually say check your blood pressure in the morning before you take your medications. Take 3 readings and average them out, and then maybe check it again in the evening. Don't keep over-checking it because that also can cause anxiety. And in some cases, over-checking your blood pressure can cause spasming of the artery a little bit and falsely elevate or lower the reading. So 5 minutes, relaxing, 3 readings, average them out, morning and night. Do it for 2 weeks. Bring that in. It's so helpful to see that because, again, you may come in and your top number is high, but then at home, your readings are fine. So what happens when that medication is doubled? You go home and you fall or you pass out or, you're having all these side effects that actually have not been picked up.
Yeah. That's a really, really good point there. I hope you all got that. In terms of home blood pressure reading, so the reason I ask people to go to their doctor's office with their home measurement device is to make sure that when they're at their doctor's office, the measurement their doctor gets is the same as their cuff. So when your doctor checks the blood pressure or the nurse, check it with your own blood pressure machine and make sure the two correlate. Do you often see a discrepancy with that? Are people's home blood pressure machines usually right or are they wildly wrong?
In general, I do find that there's usually discrepancy. In my office, I always feel that the best way of doing it is with a manual cuff. And now that's usually only available usually in a doctor's office. There are some good brands out there that overall work well. I tend to recommend Omron, OMRON is a good home blood pressure cuff. I think when we see the most discrepancies when people use the wrist ones as opposed to the arm one.
Interesting.
And then also just making sure that they're positioned right and just not taking it like over and over and over. You really don't want to define you or really like just run your day because that will drive your blood pressure up. That actually causes a lot of anxiety.
Yeah, absolutely. So you got that. And yeah, actually thinking about my close family who have blood pressure cuffs, they're all the arm cuffs and not the wrist cuffs, which makes sense that would be more accurate and in line with what doctors' offices are.
It does. I mean, we know that, it is proven that controlling your blood pressure reduces the risk of what we call major cardiovascular events. And I think the point is not to say that it doesn't. I think the point of what we like to convey is that not every blood pressure medication is appropriate for every single person. You don't need to keep piling on blood pressure medication. You need to make the changes and really adapt it for the patient itself or for you individually, because everyone is different, and what might be a good blood pressure for one person doesn't fit the other one. And I think that's a
Exactly.
really good conversation. Also, just to make sure that you're on the right medications. I always tell my patients, like, next time I see you, make sure you ask me, is there any medications we can cut back? Are they the right medications?
Yeah.
You should ask every time you see someone in the healthcare field
There
for
you
that.
go. And that's correct. And you're a good doctor and enjoy doing that, as I do. Cutting back on pills. Absolutely. The goal is to be as healthy as possible without pills, if possible. But yeah, to echo what you said, sometimes blood pressure, actually a lot of the time, yeah, people have underlying conditions. They got metabolic dysfunction and we have to give a pill to lower the blood pressure. But mostly blood pressure nowadays is a result of insulin resistance and related to lifestyle. And if anybody is so inclined, that can be reversed and improved quite quickly. And even aside from diet and exercise, stress management, good sleep, I mean, so many pillars of well-being that we've talked about before.
Of course. Absolutely.
Yeah. So if you have high blood pressure, or you've been told you've had high blood pressure, I would really advise to make sure that it's not just when you're in the doctor's office as well. White coat hypertension is a huge issue. And so many people, when I've talked about blood pressure, mention this in the comments below. Would you like to speak a little bit more about that? I mean, I think Dr. Peter here is quite scary. I'd have high blood pressure.
Yeah, I know.
Wouldn't really. He's very calming. But
Well, I think it's important.
not in your
this.
office. But what is white coat hypertension?
Well, white coat hypertension is really just the discrepancy in home readings when you come to the office. And I think that's also a little bit of a slippery path, because you also don't want to make sure that you're not just labeled as having white coat hypertension. And so for several years, you go to doctor, and they keep saying that you have white coat hypertension where actually do have hypertension. So I'll just make that as a blanket statement. I think it's important that your doctor checks your blood pressure at the end of the visit, and you should always have your blood pressure checked in both arms as well. And that's very important. That gives you a good insight into a little bit of your vascular world, which your doctor should know about. But I always have the patients because if you think about it, you've maybe fought traffic coming in, you're stressed, you're waiting in the waiting room, your mind wanders, you get called into the office. They want to weigh you and maybe don't want to be weighed. And it's just a lot of stuff going through your mind. And like, let's check your blood pressure. And so those are things. So I think just sitting down and having a conversation with your doctor, and then at the end, just rechecking your blood pressure can actually be very effective, because you'd be surprised on how much it can drop.
Yeah. Oh, it can. Yeah. And this is why it's very important as well to make sure that if your doctor's telling you have high blood pressure, check it at home and make sure that that these readings are consistently high. And typically, most doctors shouldn't, I hope, instantly start a medication first time they see high blood pressure. I mean, this is a trend in most people, but we do have a lot of metabolic dysfunction out there. So many people have high blood pressure. So we will summarize everything then from this discussion. I hope that this was helpful. I would like to finish up by emphasizing that you are unique. You're a unique person. You know your own body. I'm sure that the blood pressure that is right for you is unique to you and not what is written in a medical textbook. So yes, 120/80 might be the gold standard, but we don't want it too low and we don't want it too high. And even if your blood pressure is being treated and it might be looking like it's good, but you're not feeling good, then that might not be the right blood pressure for you. Maybe not enough blood is getting to your brain. So this is sadly what's being lost today in today's world with personalized medicine. I'm sure a few decades ago, in fact, I know a few decades ago because I was taught by old school professors, everything was very unique and they would not be aggressive as they are now, because the medical industrial complex, big pharma has come in and it's all about guidelines and let's be aggressive and lower numbers. Meanwhile, pharmaceutical companies are making tons of cash. It's really sad.
Of course.
But there are doctors out there like us who don't agree with this and want things to be personal again. And this is what we want to start, is a revolution in the medical way of thinking. And doctors out there, and lots of doctors do agree with us. Some, maybe lots, don't. But everything should always be unique to every individual, and you cannot be rigid with guidelines.
I agree, Sunil. There are some things that you can control, and there's some things that are out of your control. Being the healthiest you can be, and I tell this patient, you can carve out 20 to 30 minutes of a 24-hour day and be active, and you just find something you love to do. Really, the healthier you are, the less medications the less doctors, less hospitals.
Absolutely. That's what we want for all of you. Less doctors, less hospitals, not getting sucked into the medical industrial complex, living your best life. All right, everybody. Thank you for watching. We do appreciate it. Keep going. Stay strong. Do check in the links down below again for our separate channel. Make sure that you've subscribed to that. Also, our natural health and well-being store, ohiwellness.com. If you're in the USA, North America, ohiwellness.co. If you're in the UK and Europe, hit the like button if you like this video, the subscribe button for more similar videos in the future, and we will speak again very soon.